Harshal Rathod. I am a consultant neurologist and a epileptologist. Today, I will be speaking briefly about do's and don'ts in your signs and symptoms of epilepsy. So, first, it's very important to recognize a seizure. So, how do you recognize any person having jerky movement of a part of body, or any person having an abnormal sensation of the body tingling, or a sensation of unfamiliarness, headache, nausea, vomiting, any abnormal taste or loss, or any sense of fear? So these are the some of the signs that will help us in recognizing a seizure. So it's a very common thing, and people should be aware about it. And what is to be done if a patient or if a person has a seizure, and what is not to be done. It's a very important thing, and it can be life saving for the patients also. So if a patient has a seizure, we need to keep a safe distance from the patient. We need to loosen his clothes, call for a help initially first, and make the patient in a position, either in the left lateral position or in the right lateral position. It does not have any harmful objects nearby that can harm him, any pricking or any object that can harm him in any form. If he is wearing some tight clothes, ties or belts, that should be loosened up. Any bleeding from the mouth due to chewing of the tongue, or any froth from the mouth, any vomiters, that should be, uh, we should try to get it down in the lateral position, and that will help in not blocking the airway of the patient, and it will keep the airway maintained and patent, and so that the oxygen does not drop. Do not use any water or any pills or any substances that we try to put in the mouth so that it does not chew. This is a wrong method. It actually does harm to the patient. You should be aware that any frothing should be removed, any gagging should be removed, and as soon as and no water is to be given to the patient until he comes to fully aware state, and no medications in case of previously any doctor has advised medications such as some nasal sprays to stop the seizure, then that can be used. Immediately look for the help and call for the necessary things. Don'ts are that we should not uh, make the patient give any chest compression to the patient. This is a very wrong notion that we should give the chest compression to the patient if he is having a seizure. We should not put anything in the mouth, or those wrong beliefs that uh, कांदा लगाओ या फिर चप्पल सुंघाओ. These are all wrong things that has to be done, that are not to be done. And once the patient becomes awake, then only he should be given water or anything. And in such situation, we should not press the patients, because sometimes it can lead to fractures of the hand or back also, and patient can fall down. If you are having a sense that the patient is may fall, or if he is having sitting and he's may fall down on the ground, then you should be quickly prevent the fall, because fall and again head injury will be a bad thing for the patient. So these are the most common things that can be we can do, that helps the patient, and also don'ts that we should avoid in a patient having a seizure. Thank you.